Emergency care as a maxim of saving lives first is in and of itself a critical component of public health care, which unfortunately is often thrown in the back burner as a traditional healthcare response practice, without it being primarily a preventative mechanism of healthcare. The overall philosophy lacks in the preventative response by investing more on the curative interventions. I will examine and interrogate this component in the health sector through a series of episodes that will be highlighting the emergency cover for healthcare in Kenya. To understand this concept, I visited Kibera slum in Nairobi's central capital of Kenya to see how the government is addressing the high cost of emergency healthcare. My name is Ode Francis, a journalist based in Nairobi, and this is Health Compass. In Kenya's capital city, Nairobi, is estimated that over 75% of population live in informal settlements. Informal settlements covers 5% of the total residential land area of the city, but they are inhabited by at least half of the city's population.
The next one now, we are going to have a conversation.
With this outlay, I took Judith Okech, a former resident of Kibra slum and currently working on securing her community with affordable emergency services through her latest innovation.
Mi naitwa Judith Okech. Nime grow up hapa. Actually nilizaliwa Kibra. Nika grow up hapa until when I was about 14 years. Tukahama.
Judith comes from a family of 4 girls, all born in this slum of Kibera.
There are a lot of issues in Kibra. One of them being, of course, access to essential services, for example, health. First of all, health in this country is very expensive. So for someone who is living under $1 a day, accessing health services that can go up to 100,000, it's really 100,000 Kenya shillings. It's really something that's not possible. So there are a lot of issues around accessing health, growing up in Kibra, education, especially for girls, because a number of girls are not able to access, for example, sanitary towels. And this makes them not go to school for a couple of days, but also accessing quality education in Kibra was also not very easy.
She recalls where her mother and 4 children were living in this muddy house for 14 years, which still up to today has not been upgraded.
I don't know if my mom remembers that, or probably things I remember, but when I think it was 1994, she had gone to give birth to our 4th born. She's called Lucy, and during her labor, she could not really access any means of transport to take her, to Kenyatta. It was a struggle for her. I know she doesn't know I remember that, but I saw how she struggled to get to hospital to give birth. And from that time, I think growing up, I would just think around issues to do with how do people living in such settings access for example, emergency medical services.
Judith cannot forget her mother's experience when she really needed healthcare emergency services 27 years ago.
I know because I've lived in such settings also, even when I've grown up, and it's not easy. And I've seen, not just, within my family, but I've done a lot of work with the NGOs, and so that means a lot of community work. And in one of these visits I would make in such settings, I came about a woman. She had been stabbed about 7 times by the husband. It was around 11 a.m. on a Saturday. And back then I was insured by one of these ambulatory service providers, and I tried getting her an ambulance. But when I called, the dispatcher asked me so many questions: who was going to pay, who was with the patient, a number of questions that for me I thought were not necessary at that point, because what is important at that point to me was to save that life first, and then the rest will come after.
Through this experience, Judith identified a gap on informal population access to emergency services.
And so when she was done asking me all these questions, she told me the next available ambulance, was 45 minutes away. It really broke my heart. But then, so what we do, and this is what Kenyans do. Kenyans love helping. We have this Good Samaritan spirit. And so what happened is a number of people got a car, personal car, and the lady was put in the car, but then she didn't make it. She died on her way to the hospital. But that's also because of how she was handled. The people who are helping her were not skilled. The car itself was not equipped to, transport someone who had been injured. So it was a myriad of issues that contributed to her death. One, of course, being that she could not access that emergency service when she actually needed it as fast as possible. But then the next was, those who were trying to help in good faith did not have the skills to help this person and the tools to also help this person.
Kenya currently experiences a rising curve of non-communicable diseases, NCDs, with threefold prevalence recorded in the last 1 decade, with road traffic accident and mental health emergencies following suit.
So from there, I started thinking around what could we do, especially for people living in low-income communities, looking at issues such as access to such communities. For example, in Kibra, you've seen how, accessing such a place would be difficult for an ambulance. So I started thinking through what will be the best ways for us to access such areas. And apart from access, affordability. Because this lady was telling me to pay upfront of 5,000. And like not everyone has just 5,000, especially those living in low income communities. Not everybody just has some 5,000 Kenya shillings around, for an emergency. And so she wanted 5,000 first as a deposit before the ambulance was sent. And so looking at issues of affordability, how do then these people afford, for example, an ambulance or any response that could save a life.
Majority of healthcare burden and reluctant cost is borne by individuals and household at 40%, unlike to government input of 33%. In the light of all this, still the country does not have an organized national emergency care system, has inadequate specialized trained emergency healthcare personnel, and has not developed a standard operational procedures and emergency operation plans. A problem that Judith has challenged herself to solve.
So I looked at all these, also looking at issues of traffic, being an impediment to response. And we came up with an idea. I came up with an idea where we could provide emergency medical services to low-income communities. And so that's how Ambulex Solutions was born. Our main focus is really responding to emergency situations, especially for low-income communities. And we've looked at costs and really drastically reduced the costs through a micro-insurance solution, where a family, regardless of how big that family is, we are really also trying to reduce the, impediments that comes with insurance. So regardless of how big that nuclear family is, you only pay 100 shillings per month. And if you do have an emergency issue, we come to you.
Emergency medical response services are heavily privatized with fragmented market penetration, which makes it extremely expensive for families living in poverty to access, as the cost can go as high as 40,000 per emergency response, exclusive of hospitalization where there is need. Families that bring home less than 300 a day in income can end up spending more than 100,000 in emergency medical response services and hospitalization funding that they will have to borrow or request from family and friends.
The uniqueness is this field is about saving life. Pre-hospital care has been a field that has been neglected for quite some time. Most of the people, they are dying. We are having mortality rate that is so high because one thing, we have been missing these services. Pre-hospital care is one of the fundamental things that we are supposed to look into, because when we buy this idea, definitely we are going to reduce like maternal deaths or maternal mortality. We are going to reduce like issues of maybe fistula and many more medical issues when need arises.
More than 35% of Kenyans living in poverty are economically disadvantaged as they end up heavily in debt and not able to meet their basic human needs.
Today, ambulance in Kenya, it has been a big deal. But with 100 shillings per month, you can get your medical services at any given time. Yes.
In my next episode, we unearth the limited access to emergency services in informal settlements and its cost to delay in management and treatment of critical illnesses and injuries due to cost and infrastructural barriers that has contributed to an increased mortality, mainly in informal and rural settings. Yet integration into community systems has potential to reduce this by 45% and 39% deaths and disabilities, respectively. What could be the problem in emergency services in healthcare setting in Kenya? For Straight News TV, this is Health Compass with Ode Francis.